there's so much behind the scenes that we as consumers don't always know because it's not our field of expertise. So even your example of dental x-rays, you might get a cheaper price, but for example, I just took my kids to a place where the amount of radiation they get from the x-ray is much less. And so sometimes, unbeknownst to us, there may be things driving up cost that aren't really obvious.
It's an older machine.
But it's an older machine versus a newer machine. It's newer technology, might be a little safer for you as a consumer, but inadvertently does drive up costs.
Yeah, you want to make
so
sure
you have to really know you're comparing apples to apples. You have to really be well informed if you're going to do something
And what
like
would
this.
be really cool is if you were able, and these apps, I believe in my heart and soul, they will get to this place where you're truly comparing apples and apples. And so if you're going to get x-rays, for instance, it's similar machines, similar quality, because if it's apples and oranges, then there's no transparency at all. It's almost just confusion or obfuscation. But I tell you, transparency in healthcare pricing, anything that will help increase that transparency is a good thing. And there may come a point where you need to have an elective surgery, theoretically to remove your gallbladder, for instance. And I'm not saying an app where it's price undercutting, but maybe an app that just shows you the average price in the region. That's the app that I would love, and I think that may be in the near future. So maybe it's not bidding, but hey, what's the average cost for a facelift in Beverly Hills? Well, 3 times that of somewhere else. But
Well,
no, but then you could go online and say, well, wait, so average cost for surgery to remove your gallbladder laparoscopically in St. Louis, Missouri, on this app, it says it's X number of dollars. Well, then you could go to your doc and just say, hey, you know,
can you match
Yeah,
up?
no, I think the more informed you are, the better choices you're going to make.
match, but you could, and the doctor wouldn't even know. But
Well, we get that in what we do in elective work. Somebody
Yes.
gets a price quote somewhere. You know, I really like you, and I know how experienced you are. I know you've done so many of these facelifts, but will you do it for this much because that's what the other person said? I mean, we get that.
And do you ever?
I try to, yeah. I try to work. I mean, sometimes it's like so ridiculous. You say I can't do it for that.
Well,
but
and the one thing also is any procedure that involves insurance, then things get tricky. Dental x-rays is an example where, okay, but if I go use this provider, does my insurance kick in?
Right. Yeah. I mean, there are bidding wars in what we do that exist right now. That people compete with how much per unit and how many syringes of
And
filler
I think that's part of what this bidding on beauty, these apps are probably trying to leverage, is the fact that there are price wars out there. There are a lot of people doing cosmetic procedures, but I'm going to do you two a favor and just say, if you're going to get an elective cosmetic procedure, make sure you go to someone who's board certified in their fields, who's experienced doing what they're supposed to do. Don't always go for the lowest price.
Ask about price. Not that I want you to haggle with me, but we can discuss it.